Good afternoon and welcome to the Family and Community Engagement webinar. Today, we have the pleasure of being with Amanda Buback from the Missouri the Missouri Poison Center. I am Michelle Franklin from the Family and Community Engagement Department, and our mission is simply to partner with students, families, and staff to support families' specialized academic, social, and emotional needs to promote self-determination, equitable opportunities, and authentic inclusion. And if you have any questions or you need any information, you can always visit us at ssdmo.org/space, where there is a lot of information there. And all of our webinars are stored there, and they're live. Well, they're recorded on the YouTube channel, so they're there for you whenever you need them. This is a webinar. However, this is a recorded webinar. And so with that, we know that we are recording and we're on closed caption, and that's activated. And this webinar will be uploaded to our YouTube page. However, again, if you need this webinar or any other webinar, you can always visit us at ssdmo.org/face, or you can email us at face@ssdmo.org for any information or connections to our guests. I am going to stop sharing. And again, this is Amanda Rubrick from the Missouri Poison Center that's going to provide us with a lot of great information. And then I'm going to turn it over to Amanda.
Right. Thank you very much. I appreciate the welcome. And I am a nurse and the community outreach specialist at the Missouri Poison Center, which we'll talk a little bit more about today as I go on about what we do and how we can help you and your family. But first, I want to just talk about why. Why do we need to think about poison or poison prevention when we talk about kids across the years? Kids are at the greatest risk for poisoning. Most of our cases are 45% of our calls are for children under 5. And then the next biggest group is adults, but we get calls from every age group across the spectrum. And another concern is that children who have special needs are at a greater risk of poisoning on top of that. Results may show that children who are on the autism spectrum are more likely to visit the emergency room than our neurotypical children. And there are the greater risks of medications that are used in the home or other potential substances. And so really it's important for all of us as parents and caregivers and loved ones to think about poison prevention and how we can keep our kids safe. So I want you to think for a second and just think of what types of things do kids put in their mouth that they shouldn't. I'm sure you could probably list a laundry list of different things that a child, or maybe you yourself as a child, had heard a story about what was ingested or swallowed, things that a parent would need to call the poison center or their physician for. Most people, when I ask this question, they respond everything. Children put everything in their mouth, and that is a very true statement. It is one that we see here at the Poison Center, and certainly as parent myself, I have seen with my own children. So let's start at the basics. A poison is any substance that can harm us if it's used in the wrong way, in the wrong amount, or by the wrong person. So therefore, many things, even household products, medication, chemicals, cleaning products, things that we use in our garage or outdoors, are potential poisons. So for example, you might see some of the things listed here, and you'll see a number of medications, whether it's Norvasc or Vyvanse, Topamax. These are all medications. And medicines can become poisonous if they're used other than as directed. So, for example, a child gets into an adult's medicine box or pill planner, we could really have a serious concern. Or a double dose of medicine or some other medical medicine error. On there, you might see something that says gummy vitamins, and that is definitely one we see and hear a lot about at the Poison Center are gummy or flavored type of medicines, and children being attracted to those and getting into the box or bottle. There's also things like our household products, things we use to clean or for getting ready, like shampoo and soap and those things. And then we kind of have these other things that could be like glow sticks, for example, are very attractive to kids. They're worn right at the neck often, and children often bite and puncture those little plastic tubes, resulting in the need for a poison control call. And so we get that call a lot in the summer months and certainly on Halloween when we see extra glow sticks all over. There are other things on this list. Again, there's virtually many hundreds of thousands, millions potentially of things in our environment can become poisonous if they're used in the wrong way, in the wrong amount, or by the wrong person. So let's keep going. And I want to just tell you a little bit about poison centers in general, so you know who we are. There are 55 poison centers across the United States, and we are the Missouri Poison Center. We are located in St. Louis, Missouri, and have an affiliation with Cardinal Glennon Children's Hospital, whereas we started as a department of them. We now cover every county in Missouri, as well as every age group. And so we are not just for children, but I'm just showing you a map of all the different poison centers. And this is just a portion of some of the nurses and pharmacists that work at the Poison Center. We all are medically trained, so we have a medical background. You're not talking to a robot or a operator or call taker. You're speaking to a nurse or a pharmacist if one needs to call the Poison Center. And we also have special training in toxicology, which is the field of poison, so to speak. And we also have a physician who is a toxicologist who we can refer to, we can call if there's an unusual case or something that we need further assistance on. As I mentioned, we started as a department in Cardinal Glennon. We've been around a long time, since the 1950s, and now are the standalone department since the 1970s. You might see the poison helpline on a couple of my slides. That's the number I want you to think about when you think of poison control or Missouri Poison Center, is that 1-800-222-1222 number. That is a national number. It gets your state's poison center. So for us, who most of us probably are living in Missouri, we would get the Missouri Poison Center using that phone number. If we lived in Illinois or another state, we would get our state's poison center routed, just like 911. When you call, it routes you to your local center. People can text, or there is a web chat. We also have services for the hearing impaired, and we have a language line. So if somebody needs to speak with us in another language, we can quickly get a three-way phone call going with a translator on board. We also get lots of calls from healthcare providers. So even nurses and doctors, EMTs, veterinarians, healthcare workers do call the Poison Center when they have a patient or somebody they're caring for that it has been potentially poisoned or there is a poison exposure. And then we get lots of data, which is why we ask you a couple of questions, but all our information is completely confidential. We are HIPAA protected, just like when you go to the doctor, they protect your privacy. We do the same thing. We don't share any medical information with anyone else. So just a few more about what we do, and then we'll talk a little bit about kids and why they're at risk. Again, we cover the entire state of Missouri, and most of the calls that we receive, of course, come from where most of the people live, which is here in St. Louis, and of course, across the state there in Kansas City. We have approximately 6 million people in Missouri, and we'll look at last year, we just had under 60,000 phone calls. So that's a lot of calling across the country, or excuse me, across the state. That is a call to the Poison Center every 8 to 9 minutes, 24 hours a day. So we are 24-hour service, and we receive a call every 8 to 9 minutes or more, depending on the time of day and certainly the season. The nice thing about the Poison Center is that you can call for an exposure, meaning something happened to somebody swallowed something, somebody got something sprayed in their eyes or on their skin, or even was bitten by something poisonous or venomous, like a spider or snake, and other things. The other nice thing about the Poison Center is that you don't have to have an emergency to call the Poison Center. If you had a question relating to a poison or medication or a chemical, you can call and speak to one of the nurses for free as well. And that's really nice. Think about the times where you didn't know the dose of Tylenol for your toddler, or think about you were wondering if this pesticide could be used in your garden because you have a dog and you don't want to, put the dog at risk if it gets into the plants. Or if you're pregnant or breastfeeding, you can call and ask about medication use and other household chemicals. So lots of good reasons that you should have the Poison Center number kind of stowed away, actually saved in your cell phone is a great idea. Just to have it for those circumstances where you have a question or an exposure. So here's really what we do. When we talk about poison and poisonings, the majority of these occur as mistakes. They're accidents, right? We do something silly, our kid gets into something that they shouldn't, we make a mistake with our medicine. They are unintentional. And that's the biggest portion of calls we receive. Unfortunately, we do also receive calls for intentional behavior, meaning that self-harm or misuse of a product or substance, and those calls are there as well. But here's really what I started talking about early on, which is a lot of our calls are for kids, right? And as a parent or a caregiver, you can understand why that is. And we'll keep talking about it as we go on today. But the majority of our calls are for kids under 5. And then adults, surprisingly, are the next biggest group. So of course, our older children, 6 to 12, and our teenagers do make mistakes and have poisonings as well. But adults and young kids are most at risk. And then I've talked a lot about swallowing something. Of course, when we think of a poisoning, that is the most common way a person is poisoned, through swallowing a liquid or a solid or a medication. But we do receive calls for all the different routes, meaning it could be something on your skin or in your eyes or breathed in, like carbon monoxide or a pool chemical. And then other really encompasses a lot of other things, right? It could be an injectable medicine like an insulin mistake, or it could be a snake bite or a spider bite, or some other sort of venomous, potentially poisonous critter. I think mostly about snakes and spiders here in Missouri. But yeah, we can answer calls for all routes or ways a person is poisoned. So let's get down to just kind of figuring out why kids or our children are at greatest risk for these unwanted poisonings, these unwanted consequences. When we think about it, we want to kind of think about the youngest kids, right? As babies grow into toddlers and learn to explore, they are doing all sorts of things that make sense. They're putting their hands in their mouth to explore and understand their environment. As they get mobile, they're curious, they're exploring, they're getting into purses and cupboards and all sorts of things. There are a lot of lookalikes in our home, and we'll look at some of those, but think about candy and medicine and certain drinks and cleaning products have the same color. And so when things are out, these children aren't reading yet, they are young, right? And so they may not understand visually what they're grabbing, what they're putting in their mouth. And so that's when a lot of these poisonings happen. And then our toddlers and younger children do imitate or mimic other things. They may see, mom putting on makeup or doing something, or they may see another behavior and they begin to think that is acceptable, right? They might see a parent take medicine every day as a 2 and 3-year-old and think, well, mom does it, I can do it too, right? And so that mimicking behavior, that imitation is another reason young children are poisoned. So if we look at what they're getting into, here is the what, right? That was the why, because they're curious. Here is the what. These are the top 10 things that kids 5 and under are getting into. These are from actual calls that we receive at the Missouri Poison Center. And so last year, we had just under 19,000 cases for kids 0 to 5. And just over 1,000 of these were in the hospital or hospital cases. So surprisingly, a good portion of our patients do stay at home, and we can keep them home safely without having to be treated, but sometimes not. And so we'll talk about that. So if we look at the list, a lot of things are there, but we will notice medication is a couple of these different products. Melatonin is number one. It never used to be before several years ago, but there's a lot of use of melatonin now. They're making it in gummy flavors and liquids and chewables. It also does not have a child-resistant lid, meaning one of those harder to open lids that some adults might have trouble opening. It might surprise you that children as young as 2 years old have open child-resistant or child-proof lids. We certainly can see that once a child is able to open a round doorknob, that motion to open a doorknob, they can potentially open one of those child-resistant lids. And so it does help, right? We want to still make sure it's kept in that container, but it is not foolproof or absolutely preventative. It's just one thing that we can have to slow them down. 2 and 4 are pain relievers. And anything that involves young kids involves diapers and all the diaper care products that go along with that children get into when they're on the changing table or in getting into the bags. Foreign bodies, those are our choking hazards, are things that are small and, usually will pass without incident. Little toys, Legos, Barbie shoes, all sorts of small little items, not so much poison issue, but more of a choking hazard, certainly, which can be a big problem. Number 6 is Zyrtec, or it's an allergy medicine. So a lot of kids are on that for allergies, and it's a liquid, so they often find that tasty. Vitamins of all sorts, gummy vitamins, chewable vitamins, etc. Number 8 is Benadryl or diphenhydramine. That is often used in kids, again, with allergies. Adults use it for other things, and so kids might get into those. Hand sanitizer, more and more with our hand cleanliness, and in the winter months, we see more hand sanitizer exposures. And then essential oils, those nice smelling things, and there are a variety of different types, so it does depend on what it is to the level of toxicity or poisoning that we see. So there's the what. Let's just talk a few more times about some of the why, right? That look alike. That's so common when we talk about medicine. Many medicines have that really attractiveness, the color of something. You'll look at those red hot candies and that cold medicine there. Other things like our gummies are quite tasty and easy to access. Anything that comes in a tube, like there in the middle, can go on a toothbrush. If you're 2 years old and learning how to brush your teeth, you're certainly going to make a mistake and maybe grab the wrong thing. And then those 2 ones on the right, the one is a grape juice and one is tiki torch fuel. That's that stuff you put in the outdoor lanterns and candles. That is a very dangerous poison because it can cause pneumonia and breathing issues if a child were to choke on that. But look how that looks a lot like that grape juice. And, for a child of 2 or 3 who's not reading and thirsty, it could result in a really big issue. And sometimes it is not the kiddos that make the mistake. Sometimes it's the adult, right? We grab the wrong thing, we use the wrong product. There are a lot of lookalikes when it comes to drops, ear drops, eye drops, ointments and things that go in our eye. Looks a lot like that super glue there with the nozzle. There can be a lot of mistakes that happen. The other one there with the cold products, the one that is red in color or dark in color, that is a cold and cough medicine that you swallow, of course, you dose out. The other is for the vaporizer, the little misty thing you put in your room when it's we got that congestion. Not meant to be swallowed, but meant to be inhaled through the steam and the mist. But that is quite serious. If somebody were to swallow that, it can cause seizures and breathing difficulties. And so unfortunately, it can be rather confusing because they're sold on the similar shelf with the same brand name, and somebody could make a mistake. This is an unfortunate news incident. This was quite a few years ago, but we see these from time to time. This is a daycare that provided the children windshield washer fluid, like the blue, big jug of windshield washer fluid instead of like a sports drink or a Gatorade or juice at a daycare. And this very much is a serious poisoning, something that could be life-threatening in children. Luckily, no one was seriously harmed because they do now add sort of this bittering agent to the liquid, making it kind of yucky to taste versus sweet. But this was an adult who made a very horrible mistake, but certainly we can maybe consider in our lives when we've made a mistake that we think, why the heck did I do that? I'm looking for my phone, searching high and low, searching in every room of the house, and there it is in my hand as I'm doing it. We make mistakes, we do things that we second guess, and we consider, that this is a part of being human, right? We make mistakes that can result in injury or poisoning. I want to turn a little bit to a different topic for kids and young kids, something we definitely are seeing more and more of in the last few years. We are certainly seeing a lot more children under 5. And again, these are toddlers and young children who have swallowed or ingested cannabis edibles. Our baked goods are products that appear like other items, whether it looks like a candy variety or otherwise. Children under 5 are attracted to these things, and they are getting into them more and more in the home. You see how this is the number of kids we've had over the last few years for cannabis exposures under 5. So started off quite slow, just a couple of kids every year, and has been increasing and doubling year after year. And it has certainly for 2023 been even higher than the last year's number. So something we are concerned about, we are seeing a lot more calls about. And it's no wonder that children are attracted to these edible products. They're very tasty. They have the appearance of a regular food item. And then they're fairly potent, right? What child do you know would stop after having a single bite or a single part of an item? They're going to eat whatever's available to them. And so if the container holds multiple doses, like 20 or more doses, they could really get into a serious problem if they were to swallow some of these cannabis products. And with cannabis and young kids and edibles, we really do see a pretty severe and prolonged, meaning it lasts a long time, effect. And some of these things can make the child drowsy. They can have difficulty breathing. We have seen seizures in young children who've gotten significant amounts of edible products, and certainly have sent some to the hospital and even needing to be monitored even more closely. And so it is something to be aware of in our home if we partake in some of these products, that we keep things stored, just like I'm going to talk about when we talk about medicine and everything else. We keep our household products and certainly our cannabis stored in the original packaging, making sure things are put away each and every time, properly resealed and restored, keeping these and treating these like medicine, right? Keeping it locked up, put away, out of sight of children, and not to use these type of products in front of children due to that mimicking behavior. And then certainly if we ever have guests and visitors in our home, sometimes that is when the exposure happens. We make sure that their purses and handbags and other items are put away. Some of the same stuff applies to when we talk about medicine, as I said, right? There's really no such thing as a child-proof container. We know young kids can open those quite easily. Again, not confusing the picture by calling medicine candy. Certainly kids sometimes will test our patience and not take medicine or spit it out, and we try to do the bribery and the whole thing. And to a point, we need to make sure that we're just talking about medicine as medicine. This is medicine. This will make you feel better. You need to take it, and it is completely separate in terms of being called candy or relating to that. Safely measuring medicine is important as well, right? We know that medicine has a specific dose that we're supposed to take. And so certainly if it's liquid, we need to use the dose cup or the syringe that comes with the package. If you don't have one of those, most pharmacies will make sure you get one with a prescription. Sometimes you just have to ask. And so it's important that we measure correctly, excuse me. And then, just as we teach our children to check both ways before crossing the road and how to tie their shoe, we need to talk about things in our home that are dangerous. Teaching kids not to touch or taste anything that they don't know what it is, or to ask before they put anything in their mouth. Again, some of these kind of crossover, but safe storage is kind of the number one step when we talk about poison prevention. Keeping things in the container, up and out of sight. And then we often see mistakes happen when different family members are on medicine. So maybe you have two children and one's on a allergy med and one's on a ADHD medication. And sometimes we give the wrong child the wrong medicine, right? We are tricked into that, or we just get confused, and these things happen. We see that with parents of multiples. So if we have multiple twins or more in the house, we often see those similar mistakes. And so keeping medicine in its own container, separate from another family member's medication, clearly labeled, is really important. And also sometimes we are given liquid medicines for children that need to be refrigerated, such as an antibiotic. And those really, if we can, I know it's not always ideal, if we can keep them away from food items so the child doesn't become attracted to grabbing it as they're looking for a drink. And then again, just talking about how we talk about medicine in front of children, how we talk about things that are dangerous, talking about staying away from areas that contain poisonous items, such as our garage, under the closet, in the closet or under the sink. Telling a grown-up if they see something dangerous, or if somebody touches, tastes, or smells something that could be poisonous. I focus a lot on kids under 5 because that is, of course, our biggest age group, but I do know that you probably have older children as well, right? And if we do, there are some different risks for those age groups. For those middle-aged kids, those 6 to 12-year-olds, the why is that they're learning independence, right? They're becoming more independent. They are maybe staying alone for the first time as they get a little older there. And so there's that time without rules and boundaries, right? The time where they have to make these decisions for themselves and learn from them as well. However, there's still quite an age of magical thinking when children are faced with choices. Sometimes they don't use proper logic, right? They still might make a choice that we're like, what? I don't understand why you chose to do that, right? And that's a very normal part of this age group. And then there are the ever coming dares and challenges that we're seeing in the teen and preteen age groups. It does start pretty early, especially now with our social media as well as other types of dares and challenges. They may be put at risk. Many of these are harmless, but some are quite serious when we talk about those as well. So as I did with the little ones, let's look at the middle ones, and the top substances that kids 6 to 12 get into. Not surprisingly, there's some crossover, right? There's melatonin still there. There's our two pain relievers, still got foreign bodies and the Zyrtec and the Benadryl. Couple of new ones there. Number 3 is an medication for ADHD or hyperactivity disorders. Sometimes it's an unknown, and that's number 5. And then we have things that are usually for adults. Antihypertensives, those are blood pressure medicines. Clonidine is given to children and adults. And then we have our Benadryl again. So medications, again, are our top poison concerns when it comes to our older children. It might be that double dose. It might be a child thinking they can dose themselves at a young age, or help mom take their medicine on time, or whatever the scenario is where a mistake is made. I know this is a bit busy, but I just want to show you, remember when we talked about early kids, it's all accidents, right? Kids under 5, they're not doing anything on purpose, they're learning. And for the most part, that is the same way when it comes to our younger children. Most of the time it is still an accident. But now we're starting to see some other concerns, right? Therapeutic error, this second one from the bottom, that's a mistake. That's a medicine mistake, dosing mistake. Then the next couple of ones are intentional. And intentional is very different from unintentional or mistakes. Intentional is misuse of a product, wondering how that cold medicine will make me feel. Let's try a little bit. Or even our kiddos and our young people that are starting to be more at risk for self-harm. And so that is a concern, unfortunately, at an earlier and earlier age with many of our kids, and something we'll talk about with our teens too. So moving into the teen ages, if you have older children, they are still at risk, as we all know, and I've mentioned several times, all people are at risk for poisoning. Here are the why for our teens. First, they may be working, right? They may have exposures at the workplace, such as a fast food restaurant or cleaning in a cleaning job. And so their use of products and use of potential poisoning. There is added stress as our kids get older. I have a 12 and a 16-year-old and both boys, and there's just added stress right through those middle school and into our teenage years. There's a lot of pressure on them to get the work done, follow the instructions, all the extracurricular activities and sports and things that are going on. There's a lot going on in their world. And so that stress doesn't always manifest into something positive. It could result in them taking something or making a poor choice where a product or substance use. Then the peer pressure, we started talking about the dares and challenges. That doesn't stop, unfortunately. It just continues into our teenage years with the internet and social media. We want to be wary and aware of some of these things. On our website, which I'll show you toward the end, we have a whole blog on this topic about some of the challenges and their risks. Specifically, of course, to ones that contain medicine or other poisonous products. I'll share that with you when we get there. And then there's misconceptions, right? Sometimes our teenagers feel that they know what's best for them, that they can make their own decisions without any input. And sometimes that is true. We want them to gain that sense of independence, but we also know that many teens can make dangerous choices. So let's look at the top 10 for our teenagers. Again, same thing that we've gone through, but again, look, everyone except for one is a medication, right? It's again our pain relievers. We've got mental health medicine for number 3. Number 5 and 6 are and 8 are antidepressants, or medication for depression. And Benadryl's on there, alcohol is on there, and then trazodone, that is for a number of different things, but sometimes used for pain, seizures as well. And so again, medicine mistakes, medicine overuse or misuse is prime for when we talk about teens and their poison risks. So I feel like it's been a bit of doom and gloom, right? It's been kind of, oh, well, this must be just an outrageous thing. We're seeing poisoning left and right. And I do want to, calm your fears that yes, we do receive a lot of phone calls, but really what we see and the result for children especially is pretty minimal. We'll talk about there's some things that are higher risk, but the one and main thing I want you to know is that there is a little bit of first aid that can be done when we talk about, well, it happened. Now what do I do, right? Something happened. I don't know what to do. I'm going to panic. And that's all very normal, right? We often have to, calm down somebody to make sure we can get the story and tell them some proper first aid. The nice thing about poison first aid is that it makes a lot of sense. It is something that you probably would do intuitively. That's something that you just would do, right? So if somebody is in a room and the carbon monoxide detector is going off, or you're coughing because of the pool chemicals in the indoor pool at the hotel, we probably will remove ourselves from the room. We'll get outside and get fresh air. And then we're encouraging everyone to utilize a poison center, call for poison help. I should have mentioned at the very beginning of this that if it's ever an absolute emergency, if somebody is not breathing, they're having a seizure, or if they're very drowsy, or having a true medical emergency, 911, get medical treatment is always the first step. For the most part, that does not happen with poisoning. We're not seeing those symptoms as the first things. We are seeing some minor symptoms. So if somebody does swallow something, a child gets into the gummy vitamins, or they get into the cleaning products, what we don't do is we do not induce vomiting. And that might be a surprise to you, right? We used to make children vomit, we think get it up and out of their system, but that can be actually very dangerous. Even though we used to do that practice, we even used to give them medicine to make them throw up. That is not recommended whatsoever anymore. So we do not induce vomiting. If they're awake and alert, it's okay to give them a little something to drink to get and rinse that down. And then we would advise you to give us a call so we can tell you a little bit more what to do, some of the do's and don'ts specifically for that product. If something is on the skin, you got into the big patch of poison ivy, our first thought, of course, should be, let's get it off our skin. Let's remove the clothing that it's touching. Let's get off the boots and the shoes and really wash our skin and rinse our skin. And so 10 minutes is always a good rule of thumb when it comes to basic first aid. That's a long time. It's not just quickly washing your hands like after you use the restroom or whatnot. This is a 10-minute rinse, 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 lots and lots of water. It's okay to use soap as long as it's, not a very harsh or fragrant soap. When it comes to the eye, we think something splashed in my eye. Of course, the first thing and the natural thing we would want to do is to start rinsing our eye a little bit. And that's a very normal step. If you are wearing contact lenses, we would recommend removing those if possible, and then start rinsing the eye with lukewarm water, not too hot, not too cold, just comfortable water for about 5 to 10 minutes. And that really is to start the process. Nothing is worse than somebody getting something in their eye, getting in the car, driving 30 minutes to the emergency room, sitting in the waiting room. And then by the time they're seen, maybe an hour or two goes by, and we could have did a really thorough rinse at home. It's always good to take those first few minutes and start rinsing right away. Always with these first steps, the second step is to call for help. You know, we can be one of your resources here at the Poison Center, but if that's your physician, your pharmacist, or other healthcare provider, that's okay too. Few more slides and then we'll close things up. But I just want to share that, again, the majority of times when somebody is poisoned, especially when we're talking about children, really we see little to no effect. If you look at the map or the diagram here, red is no effect. So if somebody calls us, the majority of time, really nothing happens. And that's great. That could be because you did really good first aid, or it could be a low risk product or something non-toxic. The next little piece of the pie and that darker, that charcoal color, the bigger section, that is minor effect. And minor effects are, you know, uncomfortable, but they're not hospital worthy. That means I threw up once or got a rash or have a slight headache, something we can manage at home, which is first aid and some instructions. The little pale color there, that is moderate or major effect. Those are hospital worthy effects. Those are, you know, drowsiness or persistent vomiting or, you know, low blood pressure, other things that are related to what happened. And those are things we would advise you to seek treatment for. And that's why talking to one of our specialists is really important, because we can help weed that through. We would tell you what to do. And then additionally, we follow up and make sure you're doing okay. So if you do call the Poison Center or use the Poison Center, we're not just going to tell you what to do and then let you do it. We're going to make sure that you understand, you have the time to answer those questions, and then we're going to follow up with you. Whether it is, if we tell you to stay home, we'll call you back and just check in, or we'll text you back and check in and say, how's it going? How are you feeling? You have any concerns? And then we just make sure that we follow through. If we do need to send somebody to the hospital, we would tell you, and we would make sure that you know where the correct hospital is. And then we would also call ahead and make sure that the hospital is aware of what's going on and prep them for what happened, because they'll want specific information on that medicine or chemical. That really tiny little sliver there, the blue, that is unfortunately is death. And so there are circumstances where we have serious poisonings, and really the majority of those are more in adults and more in adults with self-harm. And so for our kids, for our everyday things, we really have a good effect and something we can manage at home. Just want to share with you a few of our resources. We have a really good website. We have a lot of great information on there, whether it is some of those trends, something about vaping or garden chemicals or household products, safety, food poisoning, snake bites, whatever you can think of, we probably got a topic on it. Our website is MissouriPoisonCenter.org, and that is where you will find both you know, some of those blogs. This is just a picture of some of the items that we mail out for free. So if you go across the top at the MissouriPoisonCenter.org, there is a section that says order materials. So if you're interested in having a magnet with our phone number or brochures on certain topics, or even posters or things, feel free to order materials. It's all free, it ships to you at no charge. If you see that little green guy there, you may recognize him if you're in my generation. That is Mr. Yuck. He is a teaching tool for children, and he might be a good teaching tool for your family if you have kids. That is a sticker that goes on different products that kids can then see and make sure that if they see it, they can recognize that it is poisonous. So you can order those for free on our website. Just gonna share with you a couple more slides and make sure this is where I'd test you out and see if you could tell me what this is. You know, we've been here long enough talking about these things that things aren't always as they seem. And so there's things like this we can talk to our kids about. There are online games as well, showing the lookalikes, and those are all again at our website. So great information, great teaching tools for you to talk to your kids about these topics. I'm going to put this on the screen for just a second. Again, the best way to to have us is to have us at your fingertips. And so if you would take a minute, you can scan that QR, and that will save the Poison Center into your cell phone, as well as download our new app, which is a free app on all devices. I'm going to wrap this up. I'm going to leave that for a minute, and I want to make sure you have my contact information. Again, I look forward to speaking with you. If you need any material or have any questions, feel free to reach out to me, and certainly call the Poison Helpline if there's anything we can help you with in terms of a poisoning. So thank you very much.
Thank you so much, Amanda. And I want to share some resources from our Family and Community Engagement Department. As always, our department is here to support families and provide resources to families. So the first flyer here is for any of our virtual workshops, family cafe, Leadership Institute that is soon and upcoming in April. If you want any information, we have QR codes for pretty much everything. So if you hover over our QR code, it gives you access to our FACE events. Also, lunch and learns. We've had so far 3 lunch and learns, and we have one coming up in January. So if you want to visit any of our lunch and learns that have been recorded, you have access to those on our YouTube page. Family Cafe has proven to be successful. It's a great opportunity for families to come and share experiences and support one another within those experiences, and show all their resilience, create new relationships, share their knowledge, show how they are being supported, and sometimes just realize how much support they really have in that space of communication. And we offer what we call a light or a minimal meal while families come together in that structured space from 6 to 8 p.m. on Thursday. Our next sessions, it's a 3-part session, and it starts in February. However, you don't have to stay. You don't have to come to all 3 sessions. It's just encouraged to be at all 3 sessions, because you really create that community when you attend all 3 sessions. And of course, our hub huddles, that's at our family resource hub, which is located at North Tech High School at 1700 Durhickey Road. We have Castle there, and Castle will be there January 5th, right? January 5th of 2024. We're going into a whole new year. And I am excited about the county the Community Action Agency of St. Louis County, and they come to help. A live representative is there to help families with utilities and housing and weatherization for their home, as well as they have food resources and a lot of other opportunities for families with education, and just really helping families to remove barriers and keep the family and the community going. We also have the Higher Education Agency there, and they assist with post-secondary education. They are coming in April, and in March, Voc Rehab will be there, and they help our individuals with disabilities gain access to employment. So we're super excited about all the great opportunities that we have in the Family Resource Hub, and those are called our hub huddles. Also, we have the Family Leadership Institute, super excited about those. These dates are our past dates, but come spring of 2024 in April, we will have our open registration soon to come. So families are encouraged to come and learn with each other and support one another as they are entering into the process of special education with their student, or if they are wanting to learn about transition. It's a lot of information, and what great way to learn and share experiences in a community setting. So we are very excited about our Family Leadership Institute. Family Academy in February 24th is going to be a new owners school, high school, and that's a Saturday event. It's from 9 to noon. The flyer is there. We are going to have a special guest. That special guest is soon to come. So again, visit our website at ssdmo.org/space for more information to come. Virtual open house is also a great opportunity for our families to learn about what special school district, what our district has to offer families, and what supports and resources that we have. I always tell families that in our partner districts, especially, that when you enter into our special school district, not only do you have the luxury of your actual school district, but you have partnered with special school districts, so you have the best of two worlds. So this is a great opportunity. It's only about 30 minutes to learn about our district and what supports and resources we have to offer. Again, I am Michelle Franklin from Family and Community Engagement Department, and I am the Family and Resource Support. You can always reach out to us on our webpage at ssdmo.org/space. You can email us at face@ssdmo.org. You can call us at 314-989-8460. And we have a QR code because we always want your feedback. We want to learn about the experiences that you have when you engage in our webinars or any of our different media resources or supports. So please give us as much feedback as possible, because we want to make sure that we are providing the best resources and supports to you and your family. Again, I want to thank Amanda Rubeck for giving us all this valuable information from the Missouri Poison Center. It really blew my mind about all the different unintentional things that we have around our home that our young people can get into, and all the things that we need to do to support our young people going forward, because the ages from 0 to 5 and 20 to 99 seem to be the most identifiable age groups that we need to just really be out and looking and be more vigilant. So I thank you again, Amanda.
Thank you. I appreciate it.
And your resources are there and available in the webinar. And I want to thank you, and I'm going to stop sharing now.